Hi everyone, and thank you to Del for inviting me today. It's actually been a very thought-provoking conference, I have to say, and I'm very pleased to be here. I'm going to share some of my key reflections from my paper, which is called Beyond the Skulls of Our Colonized Ancestors, Reflections on Psychoanalysis and South Asian Culture. So just quickly, I'm going to just briefly introduce myself. I am a psychoanalytic psychotherapist and a couples therapist in private practice. And my particular interest and focus is around South Asian experience of mental health. And the majority of clients and patients that I see are from Indian and the Pakistani diaspora. I don't have any slides to share with you, so I'll just be reading through my paper. During my psychoanalytic training, I often felt that culture was the proverbial elephant in the room. So for me, it was undeniably present, yet I felt it was persistently overlooked. Because personally, for me, culture is not peripheral. It is central to psychic life, especially for South Asian subjects. It lives in both the unconscious and the conscious. It is carried in traditions, myths, prohibitions, and also in the legacies of colonialism. And I think I'll also add in migration. This leads me to the questions that have shaped my thinking. Can a therapist truly have comprehensive knowledge of every culture, religion, or tradition? Does a therapist need cultural knowledge to work with a specific patient or a client? What does it mean to be culturally sensitive, culturally attuned, aware, and informed in the consulting room? One can argue that the cultural nuances may be difficult to grasp unless a therapist shares a similar culture, religion, or a tradition with that client. A therapist's curiosity may be received as genuine interest, or it may be experienced as ignorance and a lack of knowledge. So this carries with it a risk of positioning the client as an educator, therefore reinforcing their experience of otherness. So in the paper, my original paper, I draw on theorists such as Lowe and Samuel and cultivate what Lowe calls a thinking space, a reflective terrain where the questions of culture, power, and otherness can be thought about. This is very interesting because I think this is reflective terrain and the thinking space that has been created today in the conference today. Now, what I would like to talk about is the beginnings of psychoanalysis in India. So psychoanalysis was first introduced in India in 1920 by Jirendra Shekhar Bose. He trained as a psychiatrist, and Bose even learned German in order to read Freud in the original. Bose went on to publish his thesis, The Concept of Repression, in 1920, and he sent it to Freud in 1921, and then the correspondence between the two men continued intermittently for nearly 2 decades. And then in 1922, Bose went on to establish the first Indian Psychoanalytic Society. But Bose, from the outset, he challenged Freud's claim to the universality of the castration anxiety and Oedipus complex. Bose observed that Indian patients do not exhibit castration symptoms to such a marked degree as my European cases. The Oedipus mother is very often a combined parental image. So for Bose, the conflict was not resolved through the identification with father. It did not even have to be triangular. Instead, he said it involved two oscillating opposing wishes, where it was to be male and at the same time to be female. And the resolution was achieved through a powerful identification with the mother. Now, this maternal neutrality was later echoed by Sudhir Kakar in his idea of the maternal enthrallment, where the maternal figure exerts a captivating and a dominating influence over desire, guilt, and identity. So in the Hindu imagination, the goddess Devi or Devi Ma, meaning mother, embodies this power. She is protective, she's nurturing, yet she is all powerful and she is overwhelming, thus shaping the psychic life of the Hindu son. And this was Kakar. And then when we look at Japan, we find a striking parallel in Kusawa Hisaku's Ajasi complex. So Kusawa drew on the Buddhist myth of Prince Ajasi, where the story, the myth, begins with the prophecy, where the queen is told that her unborn son will one day kill his father. So in fear, she strikes her belly to induce miscarriage. But the child survives. And Prince Ajasi grows up, dependent on his mother, but also resentful. And manipulated by his cousins, he eventually kills his father. Therefore, the prophecy comes true. Racked with guilt, he turns back to his mother, and it is through her forgiveness that his psychic resolution becomes possible. So, unlike Freud's Oedipus, which is resolved through the paternal law, the Ajasi complex is maternal centered. There's ambivalence, guilt, dependence, and the longing of forgiveness from the mother. Alan Rowland, he highlights a crucial distinction here. He says that Japan was never colonized, therefore Kusawa could assert the Ajasi complex as culturally resonant from the very beginning. Whilst in contrast, in India, Bose was a colonized subject. Therefore, he had to negotiate Freud's authority from within the colonized frame, even though he challenged Freud's universality idea. But when we go to Ramanujan's reflections on the Mahabharata, which adds yet another perspective, we see the Bhishma episode, where Bhishma is the son, and the king, Shantanu, who's the father, he clings to desire and youth because he falls in love with a young woman and wants to marry her. But the young woman's father places a condition where he says that the son that will be born of his daughter should go to the throne, will claim the throne. So what the son Bhishma does is he submits and he renounces his sexuality and kingship for family devotion to his father. So the Oedipal drama is inverted here. The son yields and the father refuses to. So if we take this together, which is Bose, Kakar, Kusawa, Ramanujan, and Rowland, they show that how Asian psychoanalysts and thinkers reconfigured Freud's Oedipus. So rather than centering the paternal law as universal, they actually placed the maternal as the center and the culturally rooted narratives at the heart of the psychic life. I return to my initial question, which is it possible for a therapist to possess comprehensive knowledge of all cultures, religions, and traditions? Of course not. But what matters here is not the exhaustive knowledge, but a stance from the analyst. A stance which is an openness to listen, to reflect, and to allow the patient's cultural imagination and fantasies to come forth and flow. The cultural knowledge is layered, it's multifaceted. It traverses national, religious, societal, linguistic, communal, prohibitions, myths, unspoken codes, and family boundaries. And being open and curious to the discourse with the patient can create a shared space for the unconscious to emerge. But we must also remember that curiosity can be double-edged. It is powerful, it is generative, it allows the exploration, it allows the reflection to take place, yet it can also overwhelm. At times, the analyst needs to be aware that it needs to be contained. Because if the analyst's curiosity becomes too intrusive, it risks becoming obstructive. Therefore, containment of curiosity can create a more spacious field, in which the patient articulates their desires, their fantasies, their differences, their meanings in their own way. So this also raises the question, how much do we truly know a person, any person who comes to see us? Darren Leader reminds us that psychoanalysis does not claim to know what a patient means when they say they suffer from depression or anxiety. What matters is what it means for that individual in fantasy, in the unconscious, in their lived experience. Now, culture is not a symptom, but it may become the terrain on which symptoms, imaginations, and fantasies are played out or given a symbolic meaning. But we have to remember that some mechanisms of psychoanalysis are indeed universal, transference being one of these. As Freud described in 1938, the patient sees in the analyst the return, the reincarnation of some important figure out of his childhood or past, and consequently transfers onto him feelings and reactions which undoubtedly applied to this prototype. The mechanism is universal of transference, yet its inflection is cultural, because the feelings being transferred to the analyst belong to the patient's past. And this history is shaped by the culture and traditions and the myths and the histories and colonialism as well, migration. But what can also happen is often the transference involves an idealization of the analyst. For South Asian patients working with white Western analysts, transference may carry an unconscious wish towards assimilation, to become like the analyst, whether culturally, ethnically, or by belonging within the Eurocentric psychoanalytic tradition itself. So Freud himself warned against mistaking such compliance or idealization for genuine analytic work. And over here, his warning takes on renewed urgency, because when culture and power are at play, the analyst must ask, what exactly is being transferred? And does their own position risk repeating the unconscious legacies of power and exclusion? So to conclude, at the heart of my project is not the suggestion that therapists from different cultures cannot work across cultural boundaries, because we do see intercultural and interracial couples across the world, and they negotiate their differences every day. What matters is the willingness to listen, a readiness to reflect, and the recognition that culture lives within the patient's psychic life. To practice in a culturally attuned, culturally sensitive way, to reflect inwards, to consciously permit ourselves to de-shed, and to sit with the discomfort that cultural difference may evoke. Psychoanalysis does offer a valuable framework for working within professional and ethical boundaries. However, it need not demand rigidity. We must question the convention that perpetuates such inflexibility. Rigidity can function as a defense, protecting us from confronting our own unconscious biases and internalized cultural prejudices. And when this occurs, we are called to sit with the discomfort, to explore it, and to remain open to what may emerge for us as analysts. And perhaps the work of decolonizing psychotherapy begins not in these grand theoretical claims, but perhaps in the analytic encounter itself, which is the space between the analyst and patient, each bringing their differences, their histories, their cultural imaginations. And when these are met with curiosity, with recognition and openness, something new can unfold. My clinical work, the psychoanalytic space, has included cultural symbolizations as diverse as a bag rice and the unconscious meaning of the phrase to infinity and beyond. Thank you.
Thank you very much. Thank you. Thank you. So great. Thank you once again. We've just got a little bit of time for questions and comments. Anyone's got anything? Well, if anyone's not got anything to say, there's something I'm sort of trying to chew over a bit. I was thinking that maybe correct me if you think I'm wrong, but I'm thinking that you're saying something about how we might get too caught up in the idea of, let's say, knowledge and information. So if we meet somebody who comes from a particular culture, we might think we might need to go to a book or whatever to get some sort of idea of what this person has come from. But you're saying very clearly that actually it's not about information and knowledge. It's much more about the sort of space that the therapist is able to facilitate in a way. Is that wrong? Do you think what I've just?
Well, it's I mean, the thing is, we have to. For me, I think when I think about it, when I think about culture, yes, I'm talking about specifically here South Asians, right, and the culture that they come from, and I think it's the experience and the meaning of what that culture was for them, right, where they come from, and that is what I find over and over again. It's yes, because we can have, if you look at it, for example, if you start looking at for example, a culture, right? Let's look at a Muslim culture. We may also have our own unconscious biases, our own what we've read in the media or what we've read before, that we come with that, right? We're not going to be completely like a blank state. So we come with that as well. But then if you read up about it, but what about that person's own meaning that they take of that? And I think as the work progresses, that comes through, that knowledge comes through.
Okay.
If that makes, I don't know if you agree or disagree, but
well, I mean, it's just
yeah.
that doesn't
No, it's an
matter so
interesting,
much.
it's an
So
interesting
much
question. How many times do we, as analysts, go back and if somebody comes from something, and do we read up on that? Or okay, if you come, I don't know, if you come with some disorder or something, using that word, then you would probably look it up and assess.
I absolutely agree with you. For what it's worth,
Yeah.
the whole. I mean, I'm not sure how important is my agreement or not, but I absolutely agree with you that it's not the most helpful thing for the therapist to be going off to read some sort of book to find out about what this culture, because as you're saying, you don't know what the culture means to that person that you're talking to. You can't know that, and that's what I was trying to say something to you about the whole idea that you're, as a therapist, you're trying to create a kind of space which allows a person to speak, and for that to become clearer to both of you in a way. That's but
to speak, reflect, and also hear themselves, isn't it? That's what happens.
yes,
well, because they hear themselves speaking.
exactly.
Well.
Yes, absolutely.
Can I just come in and say something? I just really loved it, Shireen. I loved what you said about transference and culture and power. And I was thinking about a lovely sentence that Feluke Taylor has in her book called "Attend to the Hum of the Ghosted Space." And I was thinking about what we bring as white therapists. I'm talking for myself and for myself here. And how important my ongoing self-interrogation is of being a white therapist. Otherwise, I think I bring an unconscious, sort of agitated presence to the hum of the ghosted space. And I think the transference gets very complicated with that racialized anxiety. So I'm just thinking about our sort of ethical duty to keep interrogating, self-interrogating in a sort of way that holds ourselves with care, but also a commitment to it, if that makes any sense.
Yes, that's why I really like this idea of the thinking space, of the reflective terrain, and this idea of discomfort, because I mean there are times I had to sit in my discomfort and think about what's coming up for me as an analyst when I'm seeing a certain client, which I may not even be conscious of, right? And I guess that's why we go to supervision as well, and we use that. Because it doesn't mean that if I am a brown therapist that I'm not going to have certain biases myself, because like was first mentioned, like, you know, what is I look at myself as a colonized subject, but have I also unconsciously taken in myself, the colonizers, right?
Absolutely.
Yeah, I have a thought about some of the things that you've mentioned, Shireen. Your very interesting presentation is the need or not for us as therapists to inform ourselves on the cultural background of a specific client. And there is a temptation that we can control more the therapeutic alliance, the process, if we know more, if we go cognitive, really. But that sent me to the question of how closer do we need to be in terms of sharing the same kind of knowledge and the same kind of experience to our clients. Do we approve of branded therapy, when therapists advertise themselves as being neurodivergent, therefore having a lived experience and therefore being better therapists for neurodivergent clients? Does this mean that I myself, a heterosexual white woman, can't be a client of anybody else then who's not sharing that identity background? Would I feel misunderstood? And I do feel quite strongly in a way that even exposure to difference and exposure to the tensions that being in the unknown on both sides, the client and the therapist, is something can bring up a wealth of sentiment, a wealth of psychic material to the surface that can be very useful. Yeah, working with the challenge rather than the constant reassurance of sameness.
That's so true, but you see that quite a lot, like you said yourself, like when you see people, prospective clients, like when you see, oh, I'm looking for the very specific, it has to be this, they have to be this, they have to be this, they have to be this. And is it about, I don't know, and what came to mind was also more regulation around it, like you have to be a trauma-informed therapist, you have to be this, you have to be that to be able to work with a specific client. But like you said, when, it reminds me of when I first started training and I first started like working as a trainee with clients. How did I learn this? How did I start? And still now I'm unlearning to use something that was used by somebody else who presented. And that is how we get our experience as well, right? As therapists, I think. But if it becomes so specific, then I find myself moving away. I was like, okay, no, I'm not going to forward with this because you're looking for something very specific, and I question whether I can give you that or not. Like, for example, neurodivergent clients. I mean, it's something that's very coming up, and ADHD and things like that. It's just very much out there in the space.
I think this is a very important discussion that we probably need a bit more time for. Yeah. I think there's a lot to be said, because there's lots of people used to talk about this is about what people used to call matching, isn't it, in some ways? But but let's take it up another time. And thank you very much once again. And we now have a break.